Dr. Ho, tell us a little bit about why you're even focusing on this area of home health monitoring and virtual care.
Yeah. Well, thank you very much, first of all. Really wonderful to be joining you here. I think we have a good healthcare system, but there are gaps. I think gaps about how do we support patients in self-management, also gap about how do we as health professionals, health systems, support them in their times of need. And so I think technology, using digital health, can have that opportunity to guide us to support our patients in self-care, to also use the health system in an effective way to guide them. We use our phones in many different ways to help ourselves, but very often we use our phone to get help. So in the same way, if our health system have that ability to support our patients through digital health, it would be amazing.
So, Dr. Ho, you've talked a little bit about making that connection once the patient leaves the hospital and they're going home, sort of that bridge, using this technology as a bridge. How does that really work?
What I do is I try to prescribe apps, prescribe websites to them, so that they can actually focus their attention to start with them. They would go
to where you
beyond
know
that.
the right information.
Exactly, helpful. So virtual care, information sharing, documentation, and also about self-help.
So one of the challenges when I talk to a lot of folks, particularly when you look at technology and our health system, is how is this going to integrate into our system?
Inertia is good so that we form habits, but changing inertia is tough.
Yeah.
And so introducing digital health is a way of disrupting the current health system. But the opportunity of transformation is amazing. Our system currently is under pressure in terms of cost. The healthcare costs are rising.
Right.
The emergency department is under pressure about overcrowding. The hospitals are under pressure in terms of how do we best support patients in transition and also transition to a lower level of care. All those are important levers. And one most important lever is how do patients themselves feel that they can empower themselves to support their own illnesses. Another huge lever. Well, where can technology really help change things? And three is doing an initiative so that we can actually test out how on the co-phase technology can actually help and bring partners together and say, well, let's look at this and then figure out how individually we can change inertia. I think one needs those steps as opposed to one step from, hey, good concept, let's jump into it.
Right.